OASIS, the Outcome and Assessment Information Set, is part of the comprehensive assessment a home health agency is required to perform at the start of the home care episode. There are other parts of the comprehensive assessment, but the OASIS is typically the largest, most time-consuming part. It is important to note that under PDGM, none of the OASIS time point requirements are changing. OASIS, regardless of type, will all be performed with the same guidance as today. Under PDGM, only the functional scoring component will come directly from the OASIS. All other characteristics used to create payment will be derived from the claim. While the information to build the clinical grouping or the comorbidity adjustment for PDGM reimbursement does not flow directly from the OASIS, it is important that the information found on the OASIS regarding diagnoses is accurate and agreed upon from all the team members. The chart shows the characteristics of the model. As we just discussed, you'll see that only one grouping area in PDGM comes directly from the OASIS. This is the functional impairment level. The PDGM category for functional impairment level is based on responses to 8 OASIS items. They are M1800, which is related to a patient's grooming, M1810, or the patient's current ability to safely dress his or her upper body, M1820, which is the patient's current ability to safely dress his or her lower body, M1830, this covers the patient's bathing capabilities, M1840, which assesses the patient's ability to transfer to the toilet, M1850, or the patient's overall transferring capabilities, M1860, this covers ambulation or locomotion, and finally M1033, which is the patient's possible risk for hospitalization. The patient is classified into one of 3 functional impairment levels from the responses we just discussed. They are low, medium, or high impairment. Each OASIS response for these M items has a different calculated weight toward the rating scale used to determine that impairment level. Those response ratings relate back to historical resource use for those patients who score a particular way on each of the OASIS items we have discussed in this video. So while some responses contribute points to the overall score of the functional impairment level, other responses do not contribute. Now let's take a look at an example of this. M1820, which, as we mentioned earlier, is the ability the patient has to dress his or her lower body. As you can see in the following table, if the clinician rates the patient using the response 0 or 1, this means that 0 points contribute to the impairment level, while response 2 contributes 6 points and response 3 contributes 12 points. Next, we will dive deeper into the reason for a home care stay and comorbidities. As you may already know, a comorbidity is the presence of one or more disease processes or disorders in the same person. These are 2 or more diseases that interact in a way that requires those members of a care team to take into consideration both diseases and disorders in the treatment plan. Comorbidities and their identification in a patient's plan of care are one of the building blocks under PDGM and are considered when determining the resources needed to care for that patient. On the OASIS, there are several questions surrounding the medical reason for a home care stay, or M1021 primary diagnosis. The main reason the patient is receiving home care and the diagnosis most related to current home health plan of care may or may not be related to a recent hospital stay. Comorbidities are actively addressed in the plan of care in the M1023 secondary diagnoses and have the potential to affect responsiveness to treatment and rehabilitative prognosis, even if they are not the focus of home care treatment itself. They also have capability to impact the skilled services provided by the home health agency. One big difference between the diagnosis listed on the OASIS and the ones listed on the claim is the number allowed. The OASIS only allows 5 other diagnoses in addition to the primary diagnosis. However, the claim allows 24 secondary diagnosis codes. You should also know that there is something called a comorbidity adjustment that is determined by the list of additional diagnoses the agency puts on the Medicare claim. Once those diagnoses are examined, those codes fall into predetermined interactive subgroups and get coded for a comorbidity adjustment. There are 3 comorbidity adjustment levels available under PDGM. None, meaning there are no comorbid diagnoses that qualify for the adjustment. Low, which is where one reported secondary diagnosis falls within one of the home health comorbid subgroups that are associated with higher resource use. And high, meaning there are 2 or more secondary diagnoses that fall within a comorbid subgroup interaction. Under PDGM, a patient can qualify for only one comorbidity adjustment per 30-day payment period. In conclusion, let's discuss best practices in this new reimbursement climate regarding everything we have covered here. First and foremost, shore up your clinician's scoring of OASIS items to ensure the most accurate and authentic picture of the patient. Create a process for efficient and timely collaboration surrounding OASIS scoring among clinicians who are involved in the patient's plan of care, including therapists. This will allow the most complete picture of the patient's needs, resulting in an integrated approach to improve accuracy, create reliable outcomes, and ensure appropriate reimbursement for patient care. Keep in mind, when performing OASIS, direct observation of functional movement and self-care skills is the preferred method for authentic scoring. Also know that Section GG for mobility and self-care do not contribute to reimbursement under PDGM. However, by observing trends in the post-acute environment with the use of the GG items, it is expected that they will have an important role to play in the future. Ensuring true scoring now on those items will go a long way to position your agency for future success. As always, Aegis Therapies is here for you to create understanding surrounding these dynamic new changes to reimbursement. You can always keep up here on our Resource Center or reach out for any questions.